questions they can. Not a lot of everyone does. Hi everybody, I'm Dr. Bulow with Reive Upper Cervical, and this is Miss D. She's a patient of ours. How long, D, has it been?
Since August.
Since August.
That's when I came in for my initial consultation.
And right now we're in the beginning of November, and so it's been a couple months, right?
Yes.
And Dee was in for her appointment today. We just did a re-exam with you last time just to see some benchmarks. And in our conversation, she had expressed a little bit of some of the things she had noticed, and I thought it was pretty interesting stuff, just given your background and your injury and things. So if you don't mind, I'm just going to let Dee share a little bit about, you know, what it was that happened to you and how you came to find out about the office here.
Well, what happened was I was in a car accident initially a little over 2 years ago, near the end of September, and didn't realize that day that my injuries would morph into so much more in terms of having a severe concussion along with severe whiplash, and I was impacted twice, and impacted on the side and then in my door side, so I had hip pain also. And as I was being treated for my concussion, I would often talk about the pain I was experiencing from my whiplash. I had been seen by a regular chiropractor for a number of months. They were great and very kind and really working with me. But couldn't get me, they brought me far, but couldn't get me to the point of really being out of pain. So I sought treatment through a physical therapist, which helped, but then as I finished that segment of therapy and in-home exercises, I still, the pain reoccurred more so, and it just kept getting worse and worse. So the doctor who I was seeing for my concussion, Dr. Franco, he recommended you.
I think a couple interesting takeaways from that. Number one is that when people are in an accident, very often, if nothing, now you obviously had some issues that you had to manage there, but very often, like you said, people don't realize what the long-term effects of that accident are going to be if it's not managed properly. Right? So they have the car accident, and they feel okay, they're given the muscle relaxers, but little do they know that their body is different. Things change when you're in such an injury, and then months and years later, you start feeling the effects of it, right? So I think that's really important. If you're in an accident, if you're in a physical injury, you don't have to have a broken bone or have a big gash in your head to seek out really specific chiropractic care to see what's going on. Which brings me to the second point that you made, is that there is probably a hierarchy of things that you can do for your health. You know, you can eat right, you can exercise, you can have physical therapy, you can have standard chiropractic adjustments, you can, you know, there's all these different things, and they're all fine. That's all good for your health. But as you may have been able to determine after you started care with us, the upper neck really has a lot to do with the whole spine and the whole body, which I don't think a lot of people realize until they go through with care. So maybe you could summarize just in general what you've been experiencing over the last couple months since starting care here.
Sure. You're so right that I never thought that all these injuries would morph into so much, and I felt as though I was at the end of my rope when I found you, and I was so intrigued by your technique of gentle chiropractic treatment. It's just unbelievable. I can't believe that this works in my mind, because it's such a simple, it seems it's probably more involved with you, but to me it seemed like a simple little movement in my neck.
Here's what she's describing. I'll kind of explain it to you and to those watching. The work that we do, there was a lot of work we did on the front end, a lot of testing that's done. But when you talk about correcting the alignment of the neck, it's a very delicate thing. But it's a lot like opening up a combination lock. If you have everything, if you have all your ducks in a row, if you have all the numbers in a row in a combination lock, it shouldn't take a lot of force to move it. And so what we do is we do a lot of work on the front end, but that way, when we actually do the procedure, it's very gentle. You align your side, your head supported, and it's a little impulse behind the ear that you barely feel. But as a result, I was just trying to get the screensaver off. As a result, like today in your adjustment, the results speak for themselves. When there's inflammation, this was Dee's thermal scan before the adjustment today, and this was the scan afterwards. It doesn't take a lot of pressure to get the job done, and if we do the job right, we reduce inflammation. And how have you been doing over the first couple of months here?
Well, compared to when I first started treatment here, I feel, I'm getting very close to 100%.
That's exciting, right?
It's amazing.
Especially after a couple of years, you know what I mean?
How much better I feel. But the craziest thing is, I remember you talking about this retracing, how I would feel different things happening in my body, and just from this simple movement that you do, it's caused so much shakeup within my body in terms of this retracing, going through all the injuries from my past, where I could feel the pain that I had come alive and just feel it for about a day, and I think, oh my gosh, this pain where I had an injury on my foot, I had a herniated disc years ago, could feel that pain, but then it would disappear, and ultimately I felt as though my body was clearing out. It's a really intriguing and interesting process that takes place, and I can't tell you how uplifting it is to not only to me physically but mentally.
Yeah,
because when I came in, I was pretty sad about a lot of things that, this is me, this is what I'm going to be dealing with, and now I feel like, I found hope. And
that's awesome.
And I appreciate you. You're so kind and wonderful to interact with.
We
and
appreciate
I love coming here, and I love the restroom.
Oh, that's right.
When I tell my friends.
That's right. You get to lie down here.
The doctor takes me to the restroom, the room to rest, and that is a wonderful feeling, just to come here and rest in the Zen-like room with the nice.
When we do our procedure, everyone just rests afterwards for about 20 minutes, just to allow things to settle in. And I think a couple highlights that I have to just hit here that are so just important. You said about sometimes psychologically, people with chronic pain get to a point where they think it's just going to be this way, or worse yet, they're told that. Sometimes their doctors will say, you're going to have to get used to this. It's never going to change. And it's like, it's the worst thing. I mean, it's not a cure-all, but my thought is there's so many things, you can never put a stamp on that. The body's too miraculous as an entity. And that's the other thing that you commented on, I think is really awesome, is that when people get adjusted, healing takes place because the brain is reconnected with the body. And the thing about healing is a couple things. Number one, it takes time. It's not this thing that's going to magically make everything better overnight. But number two is there's an actual process. And I'm not downing medication because sometimes we need it in our life, but most medical interventions are more about control. And it controls the body in a certain way. But healing is this process of change and growth and evolution where the body just heals and regulates its way out of an issue. And that's what we call retracing, because it's kind of like your body finding its way back to that level of health it once had. And I just think that's so cool. And that's why I thought we should just chat, because you're kind of the ideal scenario where someone who's had a definite injury, definite problem, sadly you've been living with it with a couple years, but that means is the recovery is that much more satisfying, and you've been experiencing all the things that typically we like to see patients go through. So yeah, thank you for taking the time. Anything else you'd like to share with folks before we finish our little discussion here?
Well, I guess just to sum it up, this type of therapy is awesome because when at the end of my first treatment, I was shocked that I didn't have to do electric stim, ultrasound. I wasn't given exercises to take home, but because Dr. Bulow assures me that once the body's in alignment, once your spine's in alignment, your body will heal itself.
That's how 99% of the time, that's how it works.
That's what's really happening to me, and it's just an awesome process. I'm really excited. Yeah, it's like our business cards say, healing starts at the top, right? That's what it says on the back. So thanks again, Dee, and thank you guys for watching. If you're still with us at this point, feel free to like it and share it and all that fun stuff.
not just for us, but more importantly, there's people all over the country that have no idea that this is available to them. So
I never knew.
If you're watching this and you're out of state, yeah, and if you're out of state or you're somewhere else, comment your zip code or something. I'll help you find another colleague of mine that could take care of you. But otherwise, thanks for taking the time. Thank you, Dee, for sharing.
Telling all my friends. So thank you for.
Oh, we do what we can.
Taking care of me.
Yeah, either we'll take care of someone here, we'll help find someone local to them. It's about people getting better. So anyhow, we'll end this now. Thanks again to Dee. Thank you for watching, guys, and we'll see you next time.
Take care.
Bye now. So we're gonna hit finish here, I think. Let's see. Oh, hold on. We're gonna say bye. Sometimes it doesn't work best. Okay.